Digital innovation, I think, is the big frontier for healthcare, and we have to get to it really quickly. I think the areas we can do better in are obvious to everyone. We can have robotic support for simple tasks, delivery of food, that sort of thing.
Just in terms of digital health, it's much more complicated than just an EHR and wearables. It's how we pull it together to have platforms that give information to the patient, give information to the health service, and then how we set up a collaboration with the patients, with the doctors, the clinicians, and to say, how do we best maximise your outcomes?
I think we have to become more disciplined around that technology. But I do think if we actually use technology in an effective way, we can actually reduce our burden of work. So, for example, if we now use voice to script, we can actually record a conversation with a patient. We can take artificial intelligence to take out the niceties of the conversation, and that can actually become a download into the digital medical record. Now, that saves a lot of workload of somebody having to type a conversation following a consult. So we can just record the consult and then type.
We have some visions about digital enablement and how that will transform our services. But as I say, at the end of the day, it's always got to be people-centred, people-focused and working in partnership. It can't be something that sits out alone.
Everyone has wearables and everyone now understands how they can use it, even the older generation. But an example I'm going to give at the moment is we are looking at and piloting some technology around monitoring pregnancies. So patients want to do that. They want to complete their data on a platform, and we're getting better outcomes already, even in a pilot.
So I think it's essential we validate the tools that we're using. We make sure we are comfortable with them, both in terms of their accuracy, but also in terms of we're dealing with patient-sensitive data. So patients are also nervous about their data becoming available, for example, through cyber hacking, etc. So I think we have a need to make sure that we have a secure way of using the data, but also that there is validity in the information coming from the data.
We have to think about different ways to do the work we do today. So I think that the digital innovation piece is like the industrial revolution of our time. It is something we have to get on board for.
I think we can use AI as a clinical support decision tool. It won't become the doctor. You'll never replace the need for the doctor. But I do think it becomes a support tool for the doctor to allow them to undertake care in a better way.
It can't replace services. All it can do is augment what we do. But a lot of the work we've done in telehealth, digital health space around accident and emergency, access to mental health, access to maternity, increasingly outpatients access, the time that saves both our clinicians travelling out and our patients travelling in to specialist services has been phenomenal.